Welcome to the Long Story Longer podcast.
I'm Dominic Morano. I prescribe meds.
And I'm Katie Brzezowski, and I provide psychotherapy.
Long Story Longer is a podcast about mental health and navigating medication, therapy, and whatever else we want to talk about.
We will discuss topics from each of our perspectives. We will try to keep it to 15 minutes.
But it will probably be longer. Hello and welcome to the Long Story Longer podcast. My name is Dominic Morano. I am a family and psychiatric mental health nurse practitioner. I own my own psychiatric practice and I have a doctorate in the nursing practice. I've been in healthcare for over 20 years and more recently into mental health.
Hey, I'm Katie Brzezowski and I'm a licensed clinical social worker and I have a doctorate in clinical social work and I own a private practice and I've been in the mental health profession for over 25 years. Thank you for joining us today. This is our anniversary, our first anniversary, I guess, or...
Yeah, well, 1 year. It's been 1 year since we started this.
Yes.
Sure.
We have some great ideas for the future. We've also learned a lot from this past year. We will also just kind of talk a little bit now maybe about what we've learned from the podcast in case you're thinking of starting your own or anything like that. I don't know. Wait.
Yeah, we started this adventure. We'll call it an adventure.
Yes.
Journey, whatever.
Adventure.
With the idea that we wanted some real lived clinical experiences and wanted to go over some of the stuff that we find interesting, but that can also be confusing. And, not, sometimes textbook definitions or some explanations on social media, the internet, wherever, can be very dry. So we were going to try to use our own lived experiences to kind of describe some of the things, both some of the stuff we talked about, we were very passionate about, and mental health has so many arenas. So we just wanted to look at examples of stories. I think that was a big thing that really showcased our experiences and translated into practical understanding.
Yes, and I know that as practitioners, we like the opportunity to be able to, connect dots from our profession or connect dots with our clients or just kind of expand on what we're doing in our actual sessions, and we noticed the need for the medication side and the therapy side. Most people don't know much about either of those or they only know one. So this was just really fun. Plus we got to hang out and we got to create this thing, which is still in its infancy, but we're going to keep going.
Yeah, we're getting there. I think that from episode 1, even just editing it and trying to figure out all that, we had a raw taped one initially, and then we went to do it again, and it was not as good as the initial one because our energy, I think, was a little bit different. But
That's right.
I think you hit it on the head, Katie. I know I listen to podcasts of other providers, other mental health deliverers, and I think what makes our experience a little unique is every provider is going to be a little bit different, for one, but two, having the blending of where medication fits in and where psychotherapy fits in or all other applications of mental health. It just seemed like something that made sense. Therapists and prescribers don't always communicate. So having that
Yep.
there, I think you and I have these aha moments, even when we're just talking like as colleagues, where it's like, oh, well, that's why you do that, or oh, that makes more sense, or even just business models and marketing and stuff like that. I'm you've been doing this longer than I have for sure. We both take it from different angles in terms of our goals and what we want out of our practices for our patients and our clients. And yeah, it's just been a pretty awesome experience. It also helps like things I'm not exactly strong on to go dig a little deeper
Mhm.
and refresh that. So I feel like it's, aside from being fun, really helping my practice as a provider.
Yes, me too. I do find that because sometimes we'll pick topics that one of us is more well-versed in than the other, and then the other one has to kind of pick it up and learn a little bit more about it, which is definitely beneficial for us and for our clients. We just wanted to cut through a lot of also just the pop psychology and all of the stuff that we hear now. Like we've had episodes on that where we've really tried to break down some of the topics about like not everybody's a narcissist.
Yeah, I think there's a lot of not necessarily misinformation, not information that I would convey to my clients out there with the pop psychiatry or psychology, where not all the information you hear is good information. And that's not to say that all information is good. People could definitely disagree with our approaches, but we do like to have a little bit of evidence behind it, or at least anecdotal from our own practice versus some social influencer who doesn't know much from a professional aspect. Not to say they can't have their own mental health experiences, but then tries to take it from a professional aspect and doesn't exactly deliver uh, truly accurate stuff, I'd say.
I would agree with that, and it's not that we're being critical about, about other providers or professionals, but not everybody's expertise and education and um is equal as far as like everybody's opinion is equal. Like someone who's studied this and who has worked in it for many years, their opinion should weigh more than an influencer or someone who has not had that same amount of experience. So, just like I'm not an expert in many of the areas that we talk about. And so I wouldn't expect someone to listen to my opinion about something over someone who had spent their entire career working on that exact topic. So it's kind of like I think it's common sense, but
Yeah, it's really like where people are getting their information from. I always tell my clients I'm receptive to suggestions. Sometimes it's like your clients do the work for you. They're like, I want to be put on a citalopram for depression and anxiety. Great. I would probably have started there anyway. But or pick something different that works well in their family. But I had somebody come in and they were, we see a ton of TV commercials where people are happy running through fields and all their mental health is so much more improved. My client said, "Oh, I have a whole bunch of friends who are on this new drug. It's a Wellbutrin that's paired with dextromorphan. So it's a new antidepressant um, that's paired with Wellbutrin." And he was like, "I wanna take that for my ADHD." I'm like, "Well, that's not exactly what you're gonna
it's
take it
not
for."
even
I didn't necessarily recommend it. The patient had already been on Wellbutrin and was hoping that that may give an additional kick to it, and I don't think there's any data out there that suggests that helps as of yet. But again, that's the difference of saying, "Hey, I have friends who are on medication. Hey, I saw this, person on TikTok or YouTube or wherever, and they've tried X, Y, or Z in terms of therapy, in terms of medication." And again, our hope was to just shine a little light on the subject from our perspectives and, professional experience, I guess.
yes. So from our last episodes, I wonder what one is um your favorite. Dom, did you have a favorite?
I liked our outtakes. I mean, there is a lot of profanity there. One of the things over the year in doing the editing, think we both say about 5,464
At
times
least, at
per
least.
episode. I'm a big so when I'm thinking, I'll go, just do
Yep.
but not really. Yeah.
All of the fluff words I use, all of them.
Yeah, there's a
Too
lot
much.
there's and our editing software updates, like, I think they try to update it. It's a web-based product, and they try to update it to what people need every so often, so it changes. So I know that, 1 month we'll go into edit, and it'll look completely different, and I'm like, "Oh gosh, this
And
is not good."
and both of us with our ADHD, I feel like the editing has been a learning curve, not just because of the actual editing. The editing, we get used to it, and then even if they change it, we figure it out,
Yeah.
but it's It's the, "Okay, we finished the session," and then we're like, "Okay, do you wanna edit it or do you want me to edit it?" And then we'll pick one, and then that person will inevitably spend the next month procrastinating it until we finally come clean to the other one, we haven't done it yet, and then we go from there. So and I feel like it's been pretty equal
Oh, yeah,
in
for
that.
sure.
So, we are getting into a better system now, we actually have our next
Yeah, we
date
put
on the
down dates,
calendar.
yeah.
Yep,
Go
yep.
figure.
We're learning, yes.
Yeah,
So
we're using our own advice for ADHD recommendations. So that's we believe in the product.
yes, we do. We do. Just sometimes we don't use the product as much as we should. Um, so
Don't you think that's the case for most mental health providers? It's like,
oh,
you
for
know what
sure.
you're supposed to do. I work with, other mental health providers as clients, and they'll be like, "I don't wanna use cognitive behavioral therapy because I know all this stuff." And I wanna be like, "Well, are you really using it how it's
Yep.
intended? Because it's very effective." Maybe not for everyone, but, I think that's one of those deals where even just now, just using that as an example of we try our best
Mhm.
to incorporate those things in our life, but it's hard.
It is hard. It really is hard. And it just life is just hard for everyone in varying ways. And I feel like I think the motto that I have been using for the last few months that is like was like an aha moment for me that's kind of made things come together is I just keep saying like things change 1,000 times. And it's really true. If you think about your life, like, a year ago, 5 years ago, 10 years ago, your life was not the same as it is now. And the things you thought were important, the things that you thought were a problem, the things and even so you're always gonna be happy sometimes, and there's always gonna be sadness, and it's just like, if you just stay and move through it, you'll get something else.
Yeah, I think we started and something that was important at the time was, political anxiety. And look at
Yes.
where we are now. Go back
Oh.
in time, I'd be like, "Buckle up, buttercup. Shit's only gonna hit the fan even further."
Oh my gosh, I know, I know, I know.
Some of it's anxiety provoking, some people are really depressed about it, but I also think too that last year we didn't think we were gonna get through the year, and we did.
We did, we
Not
did.
unscathed, but
No.
certainly, we're here, have perspectives on things. I think things that can happen in life that are not ideal or bad, you can learn from for sure.
Oh, absolutely.
And I think that that's part of the process of just carrying on.
And that and changing what you can change. So if the only thing you can change is the way you think about something, if the only thing you can change is the way you react to something, if the only thing you can change is, who you're surrounding yourself with, those are the things you change then.
That was one thing that I took with me from the podcast into practice was that you can either try to change something or you can accept it. You don't have to agree with something,
Mhm.
but you can accept that it is what it is, and you don't have to like it. But you need to figure out what to do with your energy with it. Either you're going to invest into incorporating a change or work on ways in which you can live with it.
Mhm. Yep.
So I think that was huge. And when I have these like profound moments when we're doing the podcast, I'm like, damn, I sound so inspiring. And then my life is a disaster sometimes.
Yes. I think that's probably the case for many people, but also I would guess many mental health professionals because you go into this to help people. There's probably some understanding of some issues or some of the process, yourself from your own past. We are caring about everybody's situation. We are taking a lot of this on. Yes, it's our job and we chose this, but it does that creates a very interesting baseline to put or a foundation rather to put the rest of life's problems on. But we know the right stuff to do. We know how to put our own boundaries or, how to manage our own thought spirals and those things. It's just very hard to do it yourself. So that's why the best therapists or providers they have therapists because
Yeah.
it's you need that help sometimes.
Yeah. Just getting an additional perspective or validating the tools that you're using. Cause I do think, before I got into mental health, I was certainly aware of different tools and stuff like that. But going through the schooling and then applying it to, I still dabble into critical care and pulmonary medicine. And there's so much in there. I think we talked about this too, but with co-occurring health related issues. There's so much where mental health, so much that I've used in there where even just something as anxiety management for someone who's breathless or different medications that can be used for both, pain and anxiety, uh, or just setting someone up, a lot of mental health medication takes weeks to months to work. So setting someone up in the hospital, using that and applying it, like it's just it just changed my game a little bit. And you know, still still working on broadening horizons and keeping up with trends. And I think there is something that with the pop psychology that we were talking about before, there is a lot of things socially that happen that we just have to be aware of as clinicians and how that's going to impact our clients and how to tackle them. Again, political anxiety being one of them, but even just trends in medication where I think a lot of people are onto beta blockers now and they
Oh,
just love them because I think we talked about that in anxiety perhaps, but taking away that physical anxiety that your body, the heart rate, the sweating, the just just those symptoms can help so much. And the stigma now that's out there with benzodiazepines, I had a conversation with someone today, just today, about it because providers are getting audited for being heavy-handed with prescribing that, and whether they be right, wrong, or whatever, I think that that's just being aware of the things that are happening now. I think that's something that we can, you know, incorporate, or that we often try to do as well, is to incorporate that into the podcast and, like, what's happening now and
What are the
what
changes?
what are the changes, what are we doing about it in our own practices? Remember, big thing, what we do is not gospel.
Yes, yes, please, please. We're just two people trying to have a podcast and have some fun.
Yeah, exactly. And again, I've certainly had people who I wasn't a good fit for them and, uh, or vice versa. And there's plenty of options out there, but obviously I love to retain my clients if I can, but, some people subscribe to different ideologies in terms of practice, and that's just holds true for the podcast, so
And also, I feel like for anybody who's in mental health, burnout is a very real thing. And you want to create your work life and your practice as much as you can to with like burnout in mind. Like, how do I keep myself from getting burnout? And really, one of the ways is to really try, and you can't always do this as a new clinician, but to try to create a caseload of people that you feel good working with. That doesn't mean that there's certain bad clients and good clients. That's not what I mean. It just means that there's a fit. And so some people fit better with others. So find the ones that you fit with, and that's going to make you feel much better about your work, and you're not going to burn out as fast.
sure. And I think also too, we mentioned it before that you've worked with a lot of people with grief and loss.
Hmm.
That can be taxing, but something you find so very rewarding.
I do better with topics I know well because I'm not as nervous if I'm getting it right or if I'm thinking the right thing. And then you're not as stressed when you're like, okay, I feel like I've got this. And then this intervention or this client is everything's going to be okay. But when it's the ones that are very taxing, and everybody finds a different type of client taxing in a different, like,
Mhm.
I don't find grief and loss clients taxing at all. I really like working with those. Someone else might find that very taxing and might just be like, "If I have you give me a bunch of those, I'm gonna be completely depleted." So, in my practice, we have, multiple therapists, and I'm very clear with them that I care about their careers, and I want them to grow in both the company and in their profession. I have them take trainings in whatever it is that they're interested in because I want them to feel competent as they're working with that. And then it also kind of creates their own lane. And then professionally, they feel like they're more of an expert or more competent in certain areas. And then that's just a draw for clients because they know that they're going to get somebody who knows the issue that they're talking about. But if a therapist comes to me and says, I thought I would be okay working with this population, but it's very hard for me. They don't have to say anymore. I will move those clients or I will help them or figure that out because I'm not going to burn them out by giving them just whatever clients that we have that may not be a good fit for them.
There's a couple things too, even just like the business aspects of mental health in private practice, like insurances are so exhausting, and the behind the scenes work that can take a lot out. So it's that on top of the you mentioned the special populations that people I can't work with kids.
Me neither.
I and they're so deserving of care, don't get me wrong, but I am not a great care provider to them. That would be very draining to me. I think parents are immensely protective as they should be, and I found myself getting very defensive when I was dealing with parents with children. I think adults understand, that that with them, things may or may not work, but with their kids, everything just has to be perfect. It just does.
That's interesting way to put that. That's true. It's like if it was they were getting the medication, they would have a different threshold. But if it's their child getting the medication, then they are just more protective,
Yeah. Yeah,
which
and
makes sense.
it's just a very for me, it's a very an area where I'm just not comfortable, and that's just where I can serve other populations better, and it's not going to burn me out. But all right, so this was our first year. So what are we looking forward to doing in the upcoming year? I think a couple things we wanted to do is potentially consider guest speakers or anything along those lines, something that we're working on putting a couple things together. Again, we may not be experts on certain things. We certainly can touch superficially, but we are working on getting special guests to discuss things of their own specialty that uh, we may not know a whole lot of information about, but having, again, person with insight on that is useful and applicable to mental health for sure.
Yes, and the other thing that we wanna do for this year in our topics, we'd like to go into more specifically some of the, diagnoses and treatments, but we wanna explain it. So, like, for anxiety, we have planned to do multiple episodes on anxiety and breaking it down into focusing on different types of anxiety disorders. So, panic disorder,
Mhm.
and then going into, OCD, talking about generalized anxiety disorder, because they're all kind of under the umbrella of anxiety, but they are very different, and there's different medications and different treatments for all of those.
Sure, and how we differentiate underneath the anxiety umbrella, there's a ton of different, mental health conditions within there. Speaking of things on a spectrum, autism spectrum disorder, that's one that's been very popularized in terms of diagnosis now,
Mhm.
because I think we have better tools, better screening. My clients, I routinely say, "Let's look at your symptoms and where they are."
I say the
Your
same thing.
diagnosis code is simply what we use for insurances, you
Yes,
know?
yes.
And to help us organize our thoughts, even if something falls underneath the anxiety umbrella of anxiety disorders, uh, even if you don't have the exact diagnosis, because nobody's a cookie cutter diagnosis of anything, the treatment modalities are very similar. So they may be useful in terms of psychotherapy versus medication.
We also plan on talking about schizophrenia, schizoaffective disorder, grief and loss. Related to grief and loss, also, we're going to address death and dying, which is another interest of mine, and certainly something that we can speak to on both sides. Medication and therapy. We're going to talk about cannabis and mental health. So,
That is such a mixed bag of opinions between
mhm.
professionals, because I think, I mean, I'll speak for myself. I'm very pro cannabis as part of someone's treatment plan. I'd also like to incorporate other mental health medications there, and I prefer if people can have a recreational relationship with it incorporated in there, but there's some people, for instance, who just can't sleep without it, and there are no other sleep aids that work for them. So, but the stigma that they take with them, when that comes up on your chart, it's like, I look at it, I'm like, "Okay, let's see where it is," but I know there are other people like, "They're on
Oh
drugs."
my gosh.
Oh, they're going to seek narcotics or
Oh,
things
then they
along those,
start saying,
yeah,
like, "This is
it's
how
a
they are."
gateway drug,
Oh my
and
god.
yeah, so I mean, and we'll look behind, see what the data says about that, see how and how we incorporate it into our our practices. Another favorite topic of mine is mania and hypomania. I think a lot of people get very confused about the difference between the 2, and it can be underdiagnosed and people just think it's anxiety, versus it can be overdiagnosed and people will be like, "Oh, I'm manic right now," but then they take a
Oh,
nap later. So we'll get into that.
and we did talk last season about bipolar disorder
Mhm.
and about depression. You were
Borderline personality disorder and bipolar.
Oh, right, right, that's right. So we did that. So if you missed that, go back and watch it.
Yeah, it
We're
was
n
BPD versus BD.
That's right.
Confusing.
That Yes, yes, very.
I think another part what is, psychosis. Not everyone who has psychosis has schizophrenia, but it can manifest in a number of different mental health conditions and, situations. So, what is psychosis, and understanding delusions, hallucinations, and various treatments. Some of the newer things we talk about are going to coincide with what we've talked about in season 1, that sometimes medication helps upfront very quickly, and that sometimes therapy is more useful in certain instances, like the personality disorders versus medication.
Correct.
We're also going to discuss something that may be useful to other mental health providers, mental health emergencies. What do you do practically as an outpatient person, and how to look at that, how to identify.
Yes,
So,
what is a mental health emergency? Is everything or is it certain things?
yeah,
Going into that.
yeah. So I'm really excited about the stuff that we've identified. We'll talk about. We can. That's our plan. Now, plans
You
are
may never hear from us
wonderful.
again. Just kidding.
Plans are wonderful. We'll also flex to if there's anything happening socially, like if there's, uh, it's difficult right now with the economy the way it is, and affordability of healthcare. So
Mhm.
something to think about, and if something time sensitive happens, we would probably address that and kind of shuffle our things around. But that's a good idea about having a plan. It's subject to change. And then of course, most importantly, if anyone has any suggestions that are nice, um,
Yes.
that can you can say mean things nicely, but but if anyone has any suggestions, we're very receptive to it. You can go to the information page for the podcast, shoot us some ideas.
So, that has been
Our year in wrap up.
yes, and, thank you for listening to Long Story Longer. I'm Katie.
I'm Dominic, and we look forward to talking to you.
Bye.
Bye.